Hello, thank you for joining us. I'm Andy Arnold, CEO and Senior Wealth Advisor here at Centerline Wealth Advisors. This is the next episode in our series we like to call Between the Lines. We created this forum to give you some insight into our internal analytical process and the thought leadership here at Centerline. We felt it would be helpful to let you in on some of our research methodology and deliberations over a wide array of topics. Today's presentation is on Medicare, what it is and what it is not, and how you should go about applying for this important benefit. First disclosure, we are not experts per se in all things related to Medicare, but we do incorporate the financial impact of this entitlement program on our client families' financial plans. For many families, Medicare is one of the major benefits that let them begin to feel free to retire. And for that reason, we want you to be able to get this aspect of your financial life right and registered for on time. With me to present are a couple of new faces here at Centerline. We have Tom Teal, Wealth Manager and CFP, and Ben Amitajic, Financial Planning Associate. To get us started, we're going to show you a short and informative video, followed by our panel's presentation and some discussion. Please remember to enter any questions in the Q&A section, and we'll take those near the end. So let's get started.
When you're first getting started with Medicare, there can be a lot to learn and consider, and it might seem overwhelming. Let's start at the beginning with the ABCs and D of Medicare. Medicare includes parts that are the building blocks of your health and drug coverage: Part A, Part B, and Part D. And there's also Medicare Advantage, sometimes known as Medicare Part C. Let's start with Medicare Part A. Medicare Part A is sometimes called hospital insurance. It covers hospital care, like inpatient care at a hospital, skilled nursing facility care, hospice care, and some home health care. Usually, you don't need to pay a monthly premium for Part A. Medicare Part B, or medical insurance, covers services like certain doctor visits, outpatient care, medical equipment like wheelchairs, and preventive services like flu shots. With Part B, you'll pay a premium every month. In many cases, if you don't sign up when you're first eligible, you'll have to pay a late enrollment penalty, which is added to the monthly premium cost for as long as you have Part B. That can add up, so it's important to pay attention to your deadlines. Medicare Part A and Part B are both under what's called Original Medicare. If you want drug coverage too, then you can join a separate Medicare Part D plan. Medicare Part D coverage is provided by private companies that you can choose from. For a Medicare Part D plan, you'll pay a monthly premium that depends on the plan. Remember to consider your plan options when you're first eligible to avoid late enrollment penalties. And finally, there's Medicare Advantage, also known as Medicare Part C. Medicare Advantage plans are another way to get your Medicare Part A and Part B coverage. These are Medicare-approved plans offered by private companies that bundle your Part A and Part B coverage, and usually include Part D drug coverage too. Most plans include extra benefits like vision, hearing, dental, and more. Ready to learn more? Visit Medicare.gov or review the Medicare and You Handbook. You can also watch the other Get Started with Medicare videos at Medicare.gov. This product was produced at U.S. taxpayer expense.
All right. And now we're going to move into some Medicare options. We prepared these not at taxpayer expense. So Ben, if you'd like to take this section, we'd like to hear what you have to say.
Absolutely. Thank you, Andy, and welcome everyone. Thank you for joining us. So we heard a lot of alphabet soup there around what different parts of Medicare exist. And to me, always the most confusing part is that C sometimes comes after D, sometimes it comes before D. We're not really sure. And we mentioned, or we heard pieces about you get this in private coverage, you get this in public coverage. So to sort of analyze what your options are at the outset of seeking or being required to enroll in Medicare and your sort of retirement health plan. And then we'll get into a little bit about what that costs. So original Medicare, what we've had around, at least in some capacity, since about 1965. And at some point in 2030, we'll probably cover around 80 million people, are parts A and B, that cover your hospital insurance and admittance to a hospital or skilled nursing. And at the end of your life, if required, some hospice care. And then part B, which is your sort of medical provider, cardiologist, urologist, seeing a doctor for other separate treatment. Now, any place that accepts Medicare will allow you to use your part A or part B coverage there. After that, you can also opt to purchase from a private company Part D for prescription drug coverage. And all of those will pay things up to a certain point where they will no longer, or either you will have a certain out-of-pocket expectation to pay, that you can opt in to choose a Medigap policy, again, from a private company, to sort of limit your out-of-pocket expenses and make sure that you don't have some sort of disastrous event take place that is not factored into your financial plan. The other side of Medicare is Medicare Advantage, which is referred to as Part C, which can include, or is required to include at least, Part A and B. Part D is usually included as an extra benefit on top of things like dental and vision, which are not parts of original Medicare. Now, recently there was legislation to include a certain percentage of hearing coverage into Medicare, but dental and vision are still not included in that. Usually Medicare Advantage, which is offered by private companies, also offer those extra benefits, as well as offer an option to lower your out-of-pocket expenses, usually in exchange for higher premiums. But those are not the same as the Medigap insurance that you can purchase with just original Medicare. So you cannot purchase a Medigap coverage policy and a Medicare Advantage plan. They can't sell you those together. They're legally not able to, and I'm sure at some point they tried. But those will limit those out-of-pocket expenses on the Medicare Advantage side as a sort of a rider on top of your insurance to keep that out-of-pocket expense low. So we're talking a lot about what things cost. The other part of Medicare Advantage is that usually whatever private company that you're purchasing that Part C through will likely have similar requirements to your employer plans, where you're required to use certain hospital networks or doctors' offices that those health insurance companies are contracted with. So you cannot go to just any place to seek care, usually, unless it's in a case of emergency and urgent care is required, especially if you're traveling outside of your usual sometimes 10, sometimes 100-mile radius of your residence in order for companies to pay those expenses. So they really want you to use network providers.
Yeah, and we tell people to be careful on that point. Make sure your doctors are in that network before you sign up. Don't let the bells and whistles of dental and other things, fancy gym memberships, other things to entice you to lure you into one of these plans, unless it truly is a good fit. Also be aware, just this year, there have been a few articles talking about how these private companies offering Medicare Advantage are, in order to save money and boost profits, are denying treatments and tests to some extent that are paid for under original Medicare. So I think this is not a decision to make lightly. You really need to know what you're getting when you select a plan.
And they're supposed to be vetted under the Center for Medicare and Medicaid Services and be certified plans, although they have had some concerns over that audit process and that review process, and whether employers are, despite advertising a plan as meeting all those requirements, are actually following through on the payouts. Another thing to consider is that Medicare Advantage, Part D, and even Medigap insurance, since those are all the ones that can be offered by private companies, those are oftentimes the ones that you will receive solicitations for, will see advertisements for, and they have to include Part A and B and bundle your coverage that way, but they are ultimately trying to get you to purchase something that technically you're not in a lot of ways legally required to go through that avenue. So that's where they can toss on all those little bells and whistles and entice people to sign up that way, even though it might not be what's best for them, what makes the most sense for them.
Perfect.
So
Let's talk a little bit about some costs.
there is somewhat of an attitude around Medicare being free. And that comes from, while that's not necessarily true, part of that comes from the fact that Part A, you could argue your most acute required care that you would receive in a medical setting and hospital care. Technically, if you've worked the required amount of quarters of Social Security and you've paid into Medicare, odds are you've paid up your Part A premiums throughout the course of your working life, and you don't have to pay any additional premiums in retirement or after you enroll at 65. And that's sort of that's what people refer to as the premium free part of Part A. However, you'll notice that there are other costs associated with Part A that involve standard insurance items like deductibles and copays that can get drastically high, especially if there are extended hospital stays. So that's one of those things that we factor into financial plans and out-of-pocket expenses, where that needs, especially if you're going to be retiring early and you're going to be paying using other insurance ahead of time, or even after you retire, and we know what Medicare premiums might be, we know there are going to be other out-of-pocket costs associated with healthcare in retirement that are only going to get higher as time goes on. So Part A is you can enroll or submit an application to enroll in the year that you turn 65. But if you delay enrollment, you have to pay an additional premium that doesn't exist here for twice the amount of time that you could have been enrolled in Part A and weren't. So if you could have been enrolled for 2 years, but you delayed enrollment, then you have to pay an increased premium for 4 years after you finally do enroll, because this is a group health insurance plan that necessarily requires everybody that is going to be insured in it to be enrolled in it at any given time to make the coverages sort of work. And the same goes for Part B of Medicare, which has actual dollar values assigned to it in terms of costs and what you're expected to pay each month. The numbers for 2022 are slightly different, but not too drastically different. Part B works similarly in that if you don't enroll when you're eligible to enroll without any exemptions, you pay an additional premium on top of what the premium amount would have been otherwise. And that's 10% for each year you could have signed up. Now, this does not go away after twice the amount of years or anything like Part A. Part B will actually stick around for forever. As long as you're alive and paying Part B premiums, your premium will be increased as a result. There's also deductibles associated with this and co-insurance services that do still require out-of-pocket spending that are the reason that people put Medigap or max out-of-pocket riders or have to qualify for Medicaid in order to be able to pay for. And then Part D is one you have to purchase through private insurers and works similarly to Part B in the sense that you must enroll when you're eligible, or you pay 1% extra for each month, 12% a year for the rest of your life that you have Part D that never goes away after you finally enroll. So if you delay 2 years and you enroll, that is a 24% increase on your premium that sticks with you potentially through 30 some odd years of retirement. It can certainly add up. So it's definitely something you want to be on top of leading into your retirement age years. Important things to note about Part B and D, since they have a premium requirement that you must pay, once you have Social Security and when you're receiving your monthly benefit from Social Security, they will more than likely take those premiums directly from your benefit before it even gets to you. However, given that people are pushing their Social Security and a lot of clients that work with us strategically wait to turn on their Social Security for maximizing their lifetime benefits and coordinating that, it means you will have to pay sort of out of pocket from your bank account until that happens. And that's really important to stay on top of to avoid penalties there. So that's something that you want to have on your radar, typically at least a year before your 65th birthday, ideally longer, just so you know what options you have in front of you.
So some important things we want to keep in mind and remember. Tom, we'd like to hear your perspective here on working past age 65.
Sure. Thanks, Ben, for making us all experts on all the parts of Medicare. Certainly the most common questions we get revolve around that. Probably question number 2 and question number 3 we get are, when can I sign up and how do I sign up? So in terms of the when, one thing to keep in mind is you are not eligible for Medicare until you turn 65. There are a few exceptions. If you have a disability, there's a few diseases that may be covered. But by and large, if you're younger than 65 and looking to retire, if you're 62, 60, 55, whatever the number may be, always keep in mind you're going to have to pretty much cover out-of-pocket medical expenses if you or your spouse are not covered by health insurance at the companies you work for. So that's always a discussion we have with someone that's looking to them or their spouse or both are looking to retire early. So in terms of when you can sign up, again, it's when you turn 65 years old. If you are employed, there are a couple of caveats in terms of whether you can delay enrollment or not. But again, kind of the big takeaway is if you're thinking about retiring, you don't want to have to pay out-of-pocket medical expenses. You're typically going to have to wait until you're 65 years old. In terms of when you can extend or delay enrollment, so if you work for a company, a large company that has more than 20 employees, chances are you can delay signing up for Medicare because your company health insurance will cover expenses. Now, it doesn't necessarily hurt you to sign up for Medicare Part A, especially if the premium cost is 0, because you're not incurring any extra expenses. If your premium is not 0, though, in most cases, you'll want to delay enrolling in Medicare as long as you're covered by the company. And that's something we can certainly talk you through. That's no problem. If you work for a smaller company, this is where it gets a little more tricky, a little more government gray area. So if you work for a company that has fewer than 20 employees, you're most likely going to want to sign up for Medicare. Our recommendation is always to check with your HR representative. First of all, if you're not sure exactly how many employees work for the company, and if you're not sure how their health insurance will work with Medicare. But for the most part, if you work for a smaller company, less than 20 employees, you're going to want to sign up for Medicare when you're getting ready to turn 65. Medicare will be the primary provider for health insurance, and then generally the company will be secondary. And then lastly is some people ask if they have COBRA coverage. Again, in majority of the cases, it's going to be less expensive for you to sign up for Medicare. So you'll want to sign up for Medicare when you turn 65. This is kind of just a little bit more detail on those things that what we just talked about. Again, if you have questions, certainly reach out to us. We know it can get a little tricky. Obviously, the different parts of Medicare can be tricky. The premiums can be tricky, but also knowing exactly when to sign up, because we want to make sure that you sign up on time. As Ben alluded to earlier, if you sign up, there are penalties. So we definitely want to avoid that. But again, best case, if you work for what you know is a large company, you can delay. If you work for a smaller company, we want you to check with HR to see what their coverage is. And then anything outside of that, COBRA, or if you get a stipend from your employer for medical expenses, generally you're going to want to sign up for Medicare. Those Medicare doesn't typically play well with COBRA or any kinds of stipends. Well, one last piece there was the HSAs up at the top.
Yeah.
We do get questions about HSAs. So You can use your HSA to pay for medical expenses alongside Medicare. There's no conflicts there. A couple of rules of thumb. If you're getting ready to go on to Medicare and retire, we want you to stop contributing to your HSA at least 6 months in advance, just to make sure there's no tax penalties along with that. Also, if you do have major medical expenses while you're on Medicare, good to kind of check with us as to the best way to pay for any above and beyond expenses or out-of-pocket expenses. Sometimes it will make sense to use your HSA, and sometimes it may not. Again, that's all from a tax perspective. So again, if you have medical expenses, we always encourage you to save receipts because you can reimburse yourself from your HSA at any time. But if you are on Medicare and you have a major out-of-pocket medical expense and access to an HSA, again, just give us a call and we can make sure that we come up with the best strategy for paying that out-of-pocket expense.
Perfect. Now let's talk about the big day. You're already ready to sign up, enter the program. How do you go about doing that?
So the easiest way is to go to ssa.gov. We did have a question earlier about, do you sign up for Social Security at the same time that you sign up for Medicare? And the answer is, it depends on when you want to take Social Security. Again, that's something that we'll have a conversation with you about as to what makes the most sense for taking Social Security, but they are not linked together. So you don't have to take Social Security when you take Medicare, and you don't have to take Medicare when you take Social Security. So they are not connected, but they're connected in that you'll go to ssa.gov to sign up for one or both of those. We always recommend, no matter what age you are, whether you're getting ready to go into retirement or take Medicare, even if you're in your 30s, 40s, 50s, log on to ssa.gov, get your ID set up. Always verify that everything in there looks correct, that your work history looks correct, because you don't want to have to fight through getting that all fixed when it is time to retire or to take Social Security. So always log into ssa.gov, verify everything looks good. When you log in on the page, opening page, which, and Andy will show you a couple of illustrations or pictures, it's pretty clear where you go to sign up for Medicare. And you always, again, just want to make sure you're signing up for Medicare only. We don't necessarily want you to sign up for both at the same time, again, unless we've discussed it and that's the strategy. Otherwise, if you are not a fan of using computers, you dropped your phone in the pool and don't have access, you can always call Social Security at the 1-800 numbers. They can help you out, or you can contact your local Social Security office. One last caveat: if anyone works for the railroad or work for the railroad, you'll need to contact the Railroad Retirement Board. And lastly, so once you do go through the sign-up process for Medicare, it takes about 2 weeks. After that, you'll get your welcome package and your Medicare card, and you'll be set and ready to go.
So where do we find more information? The perfect site.
Medicare.gov. So really, if you have questions about Medicare that aren't answered here, or you just prefer to do some research on the internet, actually the Medicare.gov website is very good, very intuitive, relatively easy to use. I know we use it when we have Medicare questions. So if you want to just go on there, and again, if you need more detail on how the parts work, what the premiums might be, if you're going to work past 65, all those things we've kind of already talked about, questions about signing up, all that's available on Medicare.gov. You can click into the individual sections. Again, if you have specific questions, you can drill down. If you just are interested in an overview of Medicare, you can get all of that at Medicare.gov. And lastly, if you're a reader, you rather have a paper version, you can download the handbook from Medicare.gov. That way you can print it out, read through it, have it handy if you want to refer to it.
But a word of warning, if you're going to print it out, it is 4,000 pages long. Isn't that right? Is that what we discovered?
Yeah, I think in number 10 font.
Yeah. So your tax dollars at work producing the 4,000 page document. No, it's we're jesting a little bit here. It's how many pages, Ben, did you say it was?
I think it's touching 100 pages. It's thereabouts 90 to 100 pages.
So riveting reading for anyone interested. There you go. All right, so that's the bulk of the presentation. Let's see if we have some questions. And this is a good one. I didn't see any mention, but are long-term care costs covered by Medicare? And that is actually a very good question, because they are not. And so, many people get confused by that. Well, good. Once I go on to Medicare, if I have to have assistance in the home because I can't bathe, cook, take medications, get dressed, things like that, certainly Medicare will pay for it. Medicare, in certain circumstances, maybe coming out of a hospital situation and into a rehab facility, can pay a certain number of days, but it's not that many. So the basic answer is no, Medicare does not cover that. So then you're left with either paying for those expenses out of pocket, or using a long-term care policy to help you cover those expenses. So most people should be thinking about whether or not they should purchase a long-term care policy, or whether it's right for them in their 50s or maybe early 60s is a relevant time frame to be making that decision. It's a tough one to make. It's one of the hardest things we help families plan for, because you hate to spend money on premiums for something you may not use. But then again, if you need it, it can be a financial disaster. So yes, that's a question you should be exploring and thinking about, because Medicare is not really going to, or don't plan on Medicare covering much, if any of that. Let's see, Tom covered a question about Medicare and Social Security at the same time, so I think we covered that one well. And how is my Medicare Part B premium actually calculated? And that is another good question. Many people don't know. There is a base level of payment, but then if you earn over a certain amount, you could be charged a surplus on top of that. It's called IRMA, the Income Related Monthly Adjustment Amount, IRMAA. And that is based on your income from 2 years prior. So in 2022, they're looking at your tax return from 2020 to look at your level of earned income, ordinary income, modified adjusted gross income, to be more specific. And so that married filing jointly, if your income is less than $91,000, your Part B premium is set at about $170, as we had in a previous slide there. But I'm sorry, married filing jointly is $182,000. If you go $1 over that, $182,001, an extra $68 for Part B and an extra $12 for Part D are tacked on top of that for each retiree, each person on Medicare. So for a couple, you're looking at doubling that. And so those income brackets go up in steps all the way to modified adjusted gross income joint filing over $750,000, which is a lot of retirement income. But the base 170, another 408 for Part B, and an extra $78 for Part D are added on top of that per retiree. So a couple is looking at a pretty significant Medicare monthly bill if they go over certain income limits. So it's important to know that. One of the things we try to help families do at retirement is if they do have a big drop in income from high income earning profession stepping into retirement, there is a form that can be filed with Medicare that can actually take that into account. So there's certain triggering events like retirement, loss of income, marriage, divorce, death of a spouse. So all those things can be taken into account and potentially have those premiums adjusted. So that's definitely important to keep an eye on. Let's see. Here was a question. You said signing up for Medicare the year you turn 65. What if your birthday is in January? How soon can you sign up? Who wants to take that one?
You can sign up at maximum 3 months before your 65th birthday. So if your birthday is in January, the first day you could sign up would be October 1st, and your enrollment period would run through the end of April, so April 30th. So you can submit that application anywhere in that window, but just to stay on P's and Q's and everything, we typically recommend that as early a window as possible. If you're going to have to be signing up for it anyway, it's best to just get it rolling right there at the jump. So October 1st, the day of the month that your birthday is in January isn't factored into it. They allow you to go, even if your birthday is on January 27th, October 1st is still your enrollment period opening, and April 30th will still be the end of your enrollment period. So if you don't sign up within that window, that's where those penalties can start to accrue, unless you have one of those exemptions, like you work for a company with more than 20 employees on its health plan, or you will have a spouse that qualifies under that, or any other exemptions that might be applicable.
Okay. And here's another one. If you have employer insurance that you take into retirement with you, should you still take Part B?
So you may not have to. That's one of the ones that depends on your employer. If you're self-employed and not everybody is able to sign up, then you'll have to sign up for Part B. Medicare will be the primary payer on your insurance. If you work for a larger company with more than 20 employees, then you can theoretically delay coverage or delay enrollment, of Part B as long as you're employed. But you still want to double check with your HR department and the health insurance people specifically to make sure that that isn't different at the time that you actually decide to make that change.
Yeah, so some employers do pay a healthy amount toward that policy. So you wouldn't necessarily want to switch on to Part B and then have to deal with those IRMA cliffs if your employer has an acceptable option to kind of fit into that slot. So I think Ben's right. That's something you definitely want to check on. Okay, so I think we've answered all of those open questions. I did want to just right here at the end, we did add some slides to show you what the Social Security website looks like when you go to log in, and you can see here, if you can see my mouse circling, this is where you would click here in the lower right quadrant to learn more about Medicare. If you're just applying for Medicare and not Social Security, again, because you're trying to maximize your Social Security benefit, that's a whole separate issue. You can scroll down and look for this section where you apply for Medicare only. And so, yes, then you would click here to start a new application. And the site does do a pretty good job of saving your answers. So if you need to, you can return back here to complete the process.
Also, to touch on the Part B premiums a little bit more, they go based on your tax returns from 2 years ago when they calculate that premium. So if you were a high income earner in this year, when you got your Part B premium rolling, they would use your income from 2020, which you more than likely were still in the same high earning job. So in 2024 is when you can file for those IRMA exemptions to bring that premium down, and retirement being the most common one of those, to notify them that you're no longer working. And so your income is not what it was, but you'll have to wait 2 years for that to be feasible.
That's right. We could help you coordinate with filing that form as well. So it's a little tricky, but we can help you at least point you in the right direction, get you started with that. you think that affects you. All right, let's see if we have any other questions. It looks like we've answered the ones that came in. So we'd like to thank everybody for attending today. I know this topic can seem a little boring until you need it, and then all of a sudden it's pretty critical. So we wanted to be a good resource for you. Don't hesitate to reach out to us directly. Give us a call, shoot us an email. We're happy to help you take additional steps, including pointing you potentially in the direction of some Medicare coaches or other resources to help you look at different options, because we know this can be complicated and not everybody is a straight ahead case. They have very different factors and backgrounds. So, all right, everybody, thanks a lot for the help and for attending, and we'll see you next quarter for another exciting topic on Between the Lines. Have a good day.
Thanks.
Thank you.